Welcome to Project Vita's first podcast. I'm Aagam Jain. This is Aahana Jain, and we're privileged to be joined by Dr. Sashidhar. Dr. Sashidhar is an experienced nephrologist working for almost 17 years with Mahavir and Apollo.
Today we'll be speaking about dialysis. India faces a significant burden of kidney disease, with an estimate of 175,000 people on chronic kidney dialysis in 2018. And as the years go by, this number only increases. As of right now, more than 1.5 lakh people in India require dialysis every year, with chronic kidney disease emerging as a silent epidemic.
And we're super excited to get Dr. Shashidhar's insights and reviews. Welcome, Doctor.
Good morning. Yeah.
So before we begin, I think the audience as well as us would like to know more about you. We'd love to know what you do, where you started, and how you're here, Doctor.
Yeah, I'm Dr. Sashidhar, consultant nephrologist at Mahavir Hospital and Apollo Dialysis Centers. And also I'm a consultant to Apollo Secunderabad. Currently, we are doing about 70,000 dialysis per month under one single nephrologist. It's a great privilege to be here at this point and also discuss with you about the various aspects of kidney patients, what they're going through and what will be their lifestyle.
Honored to have you, Doctor.
Yeah,
really
thank
honored.
you.
So I think it would be great if you could, me and Aahana, we're well versed. We know what dialysis patients are going through. But just for the audience, if you could tell us what the disease is, what dialysis is, and how it affects patients, just briefly.
Yeah.
So, the audience will also understand what perspective you're looking at this from.
So basically, kidney disease is one of the serious type of comorbid illness, especially in Hyderabad, because Hyderabad is the diabetes capital of India, and we have a lot of patients who are suffering from kidney disease because of diabetes. And the kidney disease usually manifests as either swelling of the legs, face, any breathlessness, there a rise in creatinine. So any patient who has got diabetes for very long duration, it is ideal to screen them and then look for kidney disease. So currently, with this statistics of Hyderabad being the capital of India for diabetes, we see a lot of patients who are having chronic kidney disease. The prevalence is very high.
So if you could expand a little on how these patients come to you, especially through Mahavir, right? And what symptoms they show you and how you diagnose them. If you could just briefly explain how this process takes.
Most of the patients, they come with either swelling of the legs or any face swelling, sometimes with any difficulty in passage of urine. They come with any sudden breathlessness. They become breathless on mild exertion. They come with symptoms such as nighttime passage of urine. Some people have stone disease, so they're present with blood in the urine. These are the common symptoms which they present: loss of appetite, loss of weight and other things. These are all the common symptoms which a kidney disease is present with.
Speaking of symptoms, how do patients typically react when you break it to them that they have dialysis? How do their families react?
Most of them react in a very shocking kind of stage, because this is not a very good disease for somebody to have it, because it requires a long-term treatment. The moment you just do a preemptive test and tell them that you have mild kidney disease or major kidney disease, they're usually in a kind of a denial mode, and then they keep moving from one doctor to another doctor, thinking that probably their good news is revealed in a better way or something like that. Or they might expect that you tell them that nothing is there to worry about, or you might be healed with the kidney disease. Most of them don't want to listen to bad news.
So essentially they're in denial of the fact.
They are in the denial mode of the disease. Yeah.
We often say that when a person has dialysis, it's the end of the road for them. As a doctor, how do you react to that mindset? And what do you say when patients come to you thinking that it's the end of the road for them?
Nowadays, with the advanced modalities of dialysis and other treatments now, which is available currently in the market, we don't see it is as an end of the road treatment, because we've seen a lot of patients with good motivation, they're able to get back to our work And I have a best example of my own classmate who has been suffering from kidney disease from almost 25 years, and now he has started his own dialysis unit, which is a pan-India network, and also spreading its wings across various continents. So basically, it requires a lot of motivation, and then it is not the end of the road scenario. No more.
Yeah. And doctor, just stepping back and going to the more informational side, could you just quickly tell us, the difference between a hemodialysis care and a peritoneal dialysis? Because I'm pretty sure they're quite different, and a patient's life in each, when they're diagnosed with each one, is quite different. So if you could walk us through how a patient's day would look like for both these cases, that'd be great.
Yeah, hemodialysis is basically which has been done in the hospital-based setting. So basically, you purify the blood which runs through a machine. So basically, it is being monitored by various dialysis technician, nurses, and the hospital staff. But we have other modality called home hemodialysis, where it is being done at home. Some people they don't want to come to the hospital; they have a social phobia. So that is one more part of called home hemodialysis. Peritoneal dialysis is one which we put a catheter in the abdomen. We run through some fluids, and then the fluid comes out. This can be done at home. So the main advantage of peritoneal dialysis is for children who want to go to school, or somebody who has a social phobia to come to the hospital, or whether they are from very remote places where they cannot come to the hospital. So such patients will prefer them on peritoneal dialysis. Hemodialysis is the most common modality which has been advised in all over India. Peritoneal dialysis for a lesser extent of patient, because it has to be done by the patient or the patient's attendant. They have a phobia that it might cause some infections. But in the hemodialysis, you are being monitored in the hospital, so they have a little better scope of being monitored closely.
Of course.
Doctor, not just medically, but in terms of the patient's day-to-day lives, for both of these different types of dialysis, how would their day-to-day life be? Like, how does it differ?
So hemodialysis means you come to the hospital, you stay for 4 hours, and then the transit time nowadays, because of the traffic and other things, another 1-2 hours will total. It is a waste of almost 6 hours for a person who is being employed in some company or something like that. So if it is a peritoneal dialysis, they can do it at home. So we have dialysis, peritoneal dialysis, which can be done at night. So you just connect to the machine, the fluids, and then they can do it at night. So hemodialysis will require time. Basically, you're looking at 4 hours alternate days, so weekly thrice. That is almost 12 hours of our thing.
So, doctor, when we actually visited Mahavir Hospital, right, and we talked to a lot of dialysis patients there, and they said that they were doing hemodialysis, so they had to come to the hospital maybe 2 to 3 times a week, 4 to 5 hours, right, including the travel time. So how realistic is it for them to actually work, to join, a workforce, to contribute to society, right? Because when we talk to them, we realize that they feel like a burden to themselves, right? They feel like they're not able to contribute enough. And this sort of negative mindset is affecting their health also. So how realistic do you think is it for someone who's doing hemodialysis and has to travel so much every day? How realistic is it for them to actually join the workforce?
Yeah, basically it depends on the type of the kidney disease they have. If they're too sick, ideally because of their dialysis, they'll have a lot of protein in the body, so they feel weak and other things. But most of them who are on regular dialysis, who are doing well for many years, they can get back to their work. We have a lot of people who are working in software industry, film industries, banks. They can get back to. They usually ask their shifts according to the work what they are going with. We have some professors who are working in various colleges. They come in that particular schedule they want it. Then after that they go back to the college. They teach. They come back. So they're able to manage themselves. Generally, it depends on the motivation, as you said. It is not the end of the road scenario anymore. We see a lot of people who are on like bank service and other things. While doing the dialysis also, they are on their laptops, connecting to the call centers and all. That inspires us, because that shows a way that they can still get back to their daily routines.
That's super motivating to see. I think even when me and Aahana visited, we saw there was a will amongst the patients to work, right? They didn't want to, just because of their dialysis sessions, they didn't want to sort of, you're not able to contribute as much. They were, in fact, more motivated. And that's what our project tried to do. We tried to approach these patients and talk to them, see how they can join the workforce, how we can help them.
Yeah.
So now that we're on that point, I would like to ask you, doctor, how do you help these patients just beyond the actual dialysis treatment part? How does your help or the help that the environment is set up, at the hospital, how does that environment help them just beyond the treatment? How can, all of us as a community help these patients, on the next level, just beyond their...
See, what will happen is there are only very few nephrologists covering to a large category of patients. That is the biggest disadvantage of what is happening in India. There are only 2,500 nephrologists all over India. So they are not able to cater to each and every patient, telling them that you have to get back to your work. So we need some kind of people who can help us in delivering that kind of a motivation to the patient, saying that you can get back to work and all that. So sometimes I've seen some people who are working in the banks, they're on the calls, they're doing on their laptop. Seeing them, then the next patient says, sir, I also want to get back to my work. Can I? But then we are only looking at the treatment part, their complications, those things. Very few patients we take about their social history, what are they doing and all that. So definitely we lack in that. And I sincerely wish that whoever wants to come and join, it will be of great use to the society as well. They require a lot of motivation.
So, doctor, we just touched up more upon support systems and how people have a lot of resilience and a lot of motivation to work. But from your experience, can you tell us a story that specifically stands out about a patient who has overcome and faced these difficulties and has shown this type of motivation?
Yeah, I have one of my own classmate who has been on dialysis since 25 years. So after passing his engineering, he was going to abroad, and then he was found to have kidney disease. That was a big shock to him, but over time he has understood that he'll be a motivation to many other dialysis patients. He's been on dialysis since 25 years, and then he's shown a path that he can start his own dialysis network. Now it is one of the biggest networks in Hyderabad and all India level. So basically we have one or two major success stories who come back to their work. They do excellently well. Especially this person is very impressive and very, I think it is a lot of inspiration to many patients, because they also keep talking to him. He keeps addressing their problems, and he started his own network. So he is one of the successful dialysis. I can say that he's been an entrepreneur. He's been a motivation to other patients. He's been able to address their problems. So he's one of my favorite patient, you can call.
Doctor, speaking of networks, do you believe that the healthcare system prepares these dialysis patients adequately for life beyond the treatment? And what could doctors or institutions, communities, or the healthcare system in its own do to prepare these dialysis patients better? Do you think it equips them to work?
Actually, we have certain foundations like Kidney Warriors and all. Though mostly they help them in getting them a medical treatment or at a subsidized cost. But nobody is looking into, or any NGOs coming forward to help these patients get back to their employment or motivating them to get back to their employment. So this is an aspect which has been completely neglected.
Of course. And doctor, now that we're on this topic, I think the stories that you shared with us are about people, who were privileged in their life or had some sort of support system initially. But if we look at patients who come from probably a socioeconomic, difference in a socioeconomic factor, right? Or patients who come from rural areas, right? How is it for them, doctor? Because it's hard for them to get a job itself in the first place, right? But doing that with dialysis, it's really hard. And for that, what do you think are sort of the systems that need to be put in place, or sort of foundation organizations that need to be put in place for these patients specifically?
So if you go to the rural sectors, because we have certain patients who come from a very low socioeconomic or from the rural setups. For them, usually it is better to go at their level, address them at their level like Sarpanch or their village heads. It is good to motivate them and bring those patients to the center. And it is not that they require any rocket science to be taught or something like that. Every person has their individual capability to do some work. Even if you take a farmer who can get back to his work and then continue his farming, that itself is a major contribution, because most of them are breadwinners of the family.
Yeah.
So that is what we are looking at, because the moment they sit back and then they think that I'm on dialysis, I cannot work and all, that impairs the whole family, because most of them are breadwinners.
I'm glad you brought that up, doctor. Sorry, but you said breadwinners, right? Their family depends on them, right? So many families are there where they depend on a certain person.
Yeah.
And due to dialysis, they're not able to provide.
Yeah.
Right? And that obviously affects their family a lot.
Yeah.
So again, coming back to my original point, are there any systems in place that helps their families, help the patient beyond just the dialysis aspect? Because dialysis is one aspect of their whole lives, and it affects them in many areas. It affects their, social well-being, their mental well-being, emotional well-being. And out of what me and Aahana found, there weren't enough organizations, enough people looking at that aspect. Do you think that aspect's important? And if so, why?
That aspect is very important, because many of them go into kind of a depression when they hear that they have a kidney disease and they have to come weekly thrice. I have one more classmate of mine who himself is an ophthalmologist. He's been diabetic from very long time, but he was neglecting his health because of the work stress or whatever, currently whatever he all going through that. So he neglected his health, and during COVID time his creatinine jumped up and he was on dialysis. So then he was like he told me that I want to just end my life, I'm enough done with this. So I told him, no, there's a way to this. You have to get back to your work, because basically you're an ophthalmologist and you have to need to solve so many patients who are suffering with blindness or any other issues. So now that he has undergone a transplant and now he's doing well, he's back to the society, serving in a government medical college. And then these are very inspiring stories to many of us. So all of them can work. It is not that they are, and definitely government or any other NGOs are not looking into this aspect of getting back them to work. Most of them are only concentrating about the treatment. We are not concentrating about how they can be rehabilitated back to their society and what they can do to the society, because they are an inspiration, because they've gone through that hard journey of the kidney disease. And since it is a lifelong sustainable disease, then they should definitely get back to their work. And we don't have any such network where they can be addressed on these issues. Family needs to be addressed, because most of them say that he's on dialysis and not working. They go into a kind of burnt out situation. That family also says that till now he was a breadwinner. Now that he is not earning anything, they say that over time they also lose interest on the person and all that. So that happens. We have seen so many people going into kind of depression. The family affects, the relationships affect.
Doctor, as you said yourself that Hyderabad is the dialysis capital of India, and expanding more on Aagam's question about rural backgrounds and things like that, what are the biggest systemic or infrastructural challenges faced by dialysis patients in the healthcare system? You could speak about your experience itself working with people from rural backgrounds in Mahavir Hospital or Apollo, but in general, providing healthcare to them at a lower cost, it faces burden on the hospital itself to be able to get funds, to be able to provide healthcare to such large amounts of people. So what do you think are the biggest issues in that, what needs to be overcome?
Yeah, and just adding on Aahana's point, infrastructure issues, systematic issues, or even commuting issues, because a lot of patients come from really far.
Well, that's one thing that me and Aagam had noticed when we were taking interviews of patients to learn more about their life. We've noticed that there were people all the way from Warangal, Vikarabad, taking hour-long trains, waiting in queues, all to be burnt out very physically, just for getting healthcare.
Yeah. So what burdens it puts on the hospital and the patient aspect, if you could expand on that?
So for the patient side, if you see that definitely they want to come to a good dialysis centers. So obviously that they don't mind traveling, but then it is definitely a lot of, it takes a lot of efforts from their side to come. As you said, some people are coming all the way from Andhra, or some come all the way from Maharashtra, some come from Bidar, Karnataka. So all these are kindly very heavily motivated, because probably the dialysis facilities which are at their hospitals, they're not able to cater to them, or they're not happy with the services. Because whenever they come for dialysis, 4 hours of at least a mental peace they would expect. Because I've seen certain units like they switch off the AC, or they switch off the fan, or there'll be water disturbances from the dialysis units. Machines are not working properly. So the infrastructure is the biggest issue in the remote places. So definitely they would move to the cities for better care, because it is a lifelong issue. They would prefer a good unit which has large numbers, because they also feel satisfied when you see large number of people undergoing dialysis in the same sitting. Then they talk to them, they're like friends to them, they become a family. They're all communicating about their problems, their whatever their personal issues. They feel happy whenever they come to the dialysis unit. That itself is a big thing, because they don't want to do it in the periphery settings.
Yeah.
Most of them prefer to come to the cities, and when it is a big dialysis unit, catering to the hygiene, catering to the services, it has been monitored continuously. Obviously, they would prefer a setting like that.
I'm glad you really brought that point up, because these patients come so often, right? They meet you so often, they meet the nurses so often, right? What type of relationship has this built in the hospital? What type of environment, whether it be in Apollo or Mahavir?
Yeah.
Does it like make a family of sort amongst yourself? How is that relationship?
Yeah, they make a family among themselves. We also become like a family to them. They are when they wait in the lounges, there'll be match fixing going on. They try to getting matches among the whole families. I've seen a couple of them who got married while waiting in the dialysis unit, because see, it is a problem which needs to be addressed at a very level. So it is not wrong that they have come into a relationship or anything like that, because each who has gone through the illness will only understand what is the illness. So we have seen some matches have also been so they are all kinds of so they become like a family. Sometimes we celebrate their birthdays, we cut cakes for them. Who are on long-term dialysis, they know all the settings. They keep inspiring the other patients. Whoever come new, they tell them nothing to worry and all that. So they keep telling them, like, it becomes more like a family. So they eat together, they share their problems together, the family issues, everything is being shared among themselves. Whenever they're going through the 4 hours of dialysis, they share their movies, they share a lot of things.
So how attached do you become to them, doctor? How is your relationship with them?
Generally, we are also like knowing that it is a chronic disease, and we also become a part of them. They also invite them for the family functions and all that. They take us like a family. They tell us, sir, we want you to come as a main guest for our family functions and all. They take us like a family members.
So it's kind of like they build a community amongst themselves.
Yeah.
Coming back to the more critical side of dialysis, when patients generally come in, what are the common misconceptions that you see, and how do you personally try to help them overcome with it? Because as we see, there's a lot of misconceptions about what dialysis actually is, what happens in their day-to-day lives, and there's a lot of pre-consumed knowledge that people have that they keep mixing up with.
So whenever we say that dialysis they have to undergo, the most common question is how many times a week or how many times a month is the most common question what we encounter. And then is it so frequent, and can't we just do one session per week or something like that? Usually we prescribe them weekly thrice, but most of them they are either from the rural background or from people who come from the cities also, who are employed. They always think that will it hamper their day-to-day activities? Will they become weak when they do weekly thrice? So these are the favorite questions most of them ask when their first visit, the moment you declare that you need to undergo dialysis.
And in terms of patient education, what critical knowledge are these patients missing when they first come, or as soon as they're going through with their sessions as well? And there's been a lot of stigma around HIV patients and patients with AIDS that have dialysis. When me and Aagam visited the hospital as well, there was a lot of talking about these patients. There was a separate unit for them. How do we ensure that they are safe and that
they're included into the
Included into
actual
the
society
community?
amongst everyone?
So that's a very good question which you asked. And in this Mahavir unit, we are the only unit which is catering to the highest number of dialysis who are retroviral positive, HIV positive. So they come from different districts, and all bed sheets, everything is a single use. It has not been reused to the patients. This is one of the only setup, I think I can say it, in the entire world which caters to so many HIV patients. So a lot of people come from a lot of different states, coming for weekly twice. I have one or two patients who fly and then they get the dialysis and go back. So this is very inspirational thing which we noticed for the RVD positive patients, HIV especially. So most of them are getting single use, and what I found is surprisingly they do very well compared to the negative patients. I don't know why, because probably they've been getting because of the stigma, the fear. They come regularly to the dialysis. They're feeling well. They're eating well. Because the fear itself brings them to the doctor, because they don't want to be treated elsewhere, because this is one of the few units which caters to dialysis. So they don't want to go anywhere. They want to be with their colleagues who are getting dialysis. They're more like a family. They do dialysis together. I have one patient who is he's very motivational actually. He's gained significant weight. Usually these patients are considered to be very malnourished, very sick and all that. But this person has gained a significant weight. He's doing well. He's very compliant with the medication. He takes his HIV medicines very carefully. He's a regular on his dialysis. Now it is almost 10 years that he's on dialysis. And we keep telling him, because no disease is left not treated nowadays. Currently with the present treatment, there should not be any social phobia that if you have a HIV, it doesn't mean that you are laid back or anything like that. So we are able to cater to that HBsAg positive patient, HIV patients, HCV positive patients. HCV, because with good treatment, they have become negative, and we have reduced the number of dialysis machines. HIV and HBsAg, we still have the largest dialysis unit in our Mahavir hospital. So that is catering to a large number of patients who are coming from all over different states.
Doctor, expanding on two things that you said. First, that these patients, these HIV patients, for the patients that are from a rural background or a rural setting, and it's not sustainable for them to be buying new needles, single-use bed sheets constantly, are there any systems put up in space by the hospital itself that allows them to use these free at cost? And you also mentioned that these HIV patients have been getting treated better and have been responding better to treatments because they're more regular. Do you also think there's a psychological thing behind this, that it's something instilled in the patient's brain that allows them to react better to treatments?
Actually, they all come together because sometimes, like what you said, they come from the rural setup. So we have seen a lot of what we don't observe, at least in Hyderabad, the carpooling thing. Most of them who come from Karimnagar, there are 2-3 patients who do a carpooling, and then they come together as a one family. They say, sir, he is also from Karimnagar. We both want to come at the same time. We want the schedules accordingly. So they talk among themselves. They become more like a family. They do that carpooling. They all come together. They get the dialysis, then they go back together. So all these kind of things are very inspirational because like what you said, coming from the rural area doesn't mean that they don't require health care.
Of course.
Especially I've spoken to a lot of people from the nephrologist side, from the rural areas. Why don't you start one unit there? But none of them are willing, none of the technicians are willing to do. So still there's a lot of phobia, and all of them come here only. Even from the government setups, people send patients here. We are able to cater to them. We are able to put the lines. We are able to do all kinds of procedures. So the dialysis has been taken care. The nutrition has been taken care. I have just mentioned that one patient who has gained significant weight, he keeps inspiring the other people.
Yeah.
So he's a businessman. He keeps telling them that there's nothing lost. You can still fight for the
I
disease.
think it's sort of like a domino effect. When one patient starts feeling better, he motivates other patients, and
so coming from the rural areas, it is not that they don't have the lack of knowledge. They all know that the moment you require dialysis, now you go to Mahavir, things will be done.
And just touching more up a bit on the motivation side, do you think there is a psychological aspect that if they believe that the treatment is working better, that they do respond better to it?
Yeah, that is there because the human tendency is that the moment you feel better, then you take it. It is like a diabetic patient. You first time tell them that you need to take insulin, then they're like, no, please prescribe medicines. We don't want any injections. But the moment you feel better, that your sugars are controlled, then you feel energetic and you're able to get back to your work. The same thing applies to a dialysis patient. The initial phobia will be there, but once they feel better, they're able to eat better, they're able to gain weight, they become self-confident. They're able to get back to their work activities. They themselves come and say, sir, we missed our schedule. It is, unfortunately, we had this function or we went to somewhere outside the city, but we want to come back. They call us and then they tell us that we want to be compliant.
So it's a great community setup.
Yeah.
It's very nice for not only the patients, but also for you to work in.
Yeah. So we have this concept called holiday dialysis. When they go to Goa or they go to any other place, Agra or something, we have our Mahavir, other places also across India. So we tell them you can go to one of our fellow associated networks there, so you can get your dialysis done. So 2-3 sessions they go to Goa, they get their dialysis. They also need a break. It is not that
Of
the
course,
same
100%.
keep. So they do that. We have units in Agra. They want to see the Taj Mahal, so they go see and come back. And they do the dialysis. They come back.
So as a doctor, as you mentioned these different, that on vacations that they can still take dialysis, what do you think is the future of dialysis treatment is, or what do you aspire for it to be like? For these type of systems to be set up, that there's flexible hospitals where dialysis patients can take treatments across India or even worldwide in general.
So because you're so experienced, I think you've seen this industry for a very long time. You've been with these patients for so long. What do you think is like ideal for these patients? What sort of setup do you think in the future should be set up essentially for these patients?
The ideal thing is that you create an environment by which they are being motivated. We need multiple people at multiple levels because the doctor only takes care of the treatment. That social aspects we are not able to cater.
Yeah.
We need a lot of people who can put in their efforts in, making the unit a better place. You need to talk to them repeatedly, be getting motivated.
Yeah.
Whatever their concerns are, that requires a lot of staff who can, or NGOs or any other working bodies who can concentrate on this. Because many aspects of dialysis are been, some will like some greenery around their place. They want more plantations in the dialysis unit.
Small aspects.
Small
really
aspects. Some want some good painting. Some want meditation to be done. So we are more now concentrating on these aspects. Like even the government from funding or these things have not been taken care. So now we are training certain patients on meditation. They say that once they're doing meditation along with their colleagues, they feel that their blood pressure is under control, the sugars are under control, because they feel that they are being more relaxed while doing the procedure, that apprehension, that stress is not there.
So
Smaller steps to improve their surroundings and their well-being.
Yeah, some require some small forms of motivational exercises. So any small exercises, some physiotherapists come talk to them, dietitian come talk to them. then somebody comes and tell them that you can get back to your work. So it requires multidisciplinary approach is required.
So, doctor, on this note, because you brought up how so many aspects are neglected, I would like to introduce our project. So, our project is called Project Vita. So, what we're doing is we're going to dialysis patients, we're talking to them, we're getting them to, sit with them and motivate them about their life, right? Help them come back into their routine. We started by getting these dialysis patients trained, vocational skills, soft skills, such as, handy jobs, repairing, email writing, conversational skills. So all these skills were developed through a 8-week program, right?
We also partnered up with ICICI Bank with their CSR project. We basically empowered a few dialysis patients through these 8-week vocational training program where they learned technical skills and they had interviews for jobs as well. And in fact, a few of them landed placements.
So I think at this moment we had 4 or 5 patients who landed jobs, have a good salary, a good income from previously nothing to now having, a stable job, right? And we talked to them after they got their jobs, we talked to their family and we got a lot of positive feedback from them, We realized that's a really helpful process. And now we're trying to take this to the next level, right? And that's why we wanted your feedback also, how you think this is helpful.
This is a very good, excellent initiative because recently I came across one patient who was discussing about this only, that he was previously a bank employer. He was very good in email writing and all that. He has that exceptional skill that he can communicate well and to his seniors and all that. So once he has been on dialysis, he went back and he was not willing to join back the bank. He underwent 2 transplants. That is almost 15 years of journey. That gap was there. So recently when I was talking to him, then I asked him, what work were you doing? He said, I was like a bank employee and I was very good at writing emails. So a bank manager used to make me draft all the mails and all that because he was from a good English background that he could. And I told, why don't you get back to this work? Then he said like, oh, I have a gap of 15 years. Then I said, your language won't disappear, no? Once you learn, you can still continue. That is what you are also exactly looking into that.
Of course,
and I'm glad that you brought up this thing because many people require motivation. They are always in that social phobia, like what people will think, that why did I come back to my job? That look down upon me, nothing like that,
Yeah.
Because just recently, my experience, I was talking to him. He was telling me that 15 years back, I was drafting mails and all that.
Yeah.
Now I want to get back. I said, you should gladly get back. Then he was thinking that, what will my bank think about me? And I said, that is not a problem at all. Absolutely no
I think
problem.
there's a stigma around this.
Yeah.
I think they feel like once they're out of this workforce, work zone for a while, they feel it's hard to get back.
Yeah.
But in reality, all they need is a brush up on a few skills.
Yeah.
And they're more than ready to come back.
Yeah.
So with this project, we're not only looking at employment, we're looking at other aspects, right? We're looking at their spiritual life.
Yeah.
We're looking at their health, their physical health. So we just wanted your feedback on how we can improve these. So what we thought was meditation works, maybe exercise works, right? Putting them into, like you said, a happier environment, more greenery, something like that.
Yeah.
So what are other aspects that you think we should look at and how we can help them?
So you can regularly interact with them. You can tell who have got back to their work, or supposing you say that some people have got back into ICSA. So those people should come and talk to these patients, at least at the counseling rooms and other things, that you can still get back to your work. We have different kinds of modalities of jobs. So some are beauticians, some are makeup artists. So recently I had one patient who have been a makeup artist from Mumbai. He's come all the way. He says, sir, I heard about this dialysis unit. I want to continue here. So he's happy here. But then he was thinking, should I join the industry here? I said, you should go back. You should still, it is not that Mumbai can create jobs for you. You should still try to explore the local industry and other thing. Then he was saying like the phobia is there, sir, that should I get back?
Yeah.
So it is not that in one sector, they are good at multiple levels. So obviously they should get back to their jobs.
Doctor, coming back to employment, one thing that me and Aagam have noticed ourselves is that a lot of these patients, they're motivated to work, they're incredibly excited to work and want to itself, but a lot of them can't because of their strenuous dialysis schedules. Since a lot of them are on alternate days a week and last for hours, it's just not physically or generally possible for them to commute to the workplace at time, especially because it would cut a lot of their work day.
And not only that, I think a lot of employers, a lot of corporations, they're very strict with their timings. And the work timings for the patients doesn't match with their dialysis timings. It doesn't work coherently. So it's hard for the employer also to employ these dialysis patients. So what are some solutions and strategies?
So this is a very practical question what you asked, because we also face this question when we tell people who are working and all that. So they tell that their schedule is from the morning till evening, and so we have noticed that they themselves come with a solution that that they want to do the session in the evening slot or in the night slot. But from hospital side or from administrative side, actually we should be looking at a fourth shift. So usually we have only 3 shifts, which starts from 6 to 10, then 10 to 2, then 2 to 6 or like that, and after that we close. But ideally it is good for us to, or especially for people who are employed, who wants an evening schedule from, again, for them especially 6 to 10 or something, it will be an ideal this thing. So if you take European countries, they have this concept called nocturnal dialysis. So they come, they do their dialysis in the night time. So they get back to work in the mornings. Or some who want to go for a schedule in the morning slot, like they go from 8 to 6 or something like that. They get the dialysis from night shifts, like, when they start their work, they get the dialysis from 4 a.m. to 8 a.m. like that. So all kinds of possibilities are there. I have a few patients who get their dialysis like that, 4 a.m. to 8 a.m. They bring their breakfast, they do everything. And then by 8 o'clock, they get back to their work. 8 to 6, they work. Then again, the schedule goes on. So basically, it is a flexibility of the timings at what we are looking at. And from the hospital side and the administrative side, I think we should accommodate them. Yeah. See, what you are saying is absolutely correct and very practical question you asked. And it is our duty and responsibility, like what we discussed earlier also. Most of them are breadwinners of the family. They are an inspiration to the society. And what we do as doctors we should definitely look into these aspects as well, because we should try to accommodate them, understand them. We always tell that you miss dialysis because of your work and all that. But trying to understand like what you people, youngsters, are doing, that, adjust them according to their schedule. So that requires motivation from the hospital side and also motivation from the technicians to do that extra efforts to do an extra session for them whenever it is necessary, because very few patients will come night. Yeah. So they want to come in the night, and many who don't want in the night are being given in the night schedule. They say that we cannot get back because of the autos and all that. But these people who are working, they'll get back.
If they will,
yeah, they have a will to do it.
Through.
And from admin or from the hospital side, we should be definitely looking into these aspects.
Doctor, from the more administrative side, from the technician side, you get a lot of these dialysis patients throughout the day that come for their treatment, and it can get hectic for the nurses, it can get hectic for the doctors, for the technicians as well, right? What is something that you recommend to be input, or what doctors do to prevent this from getting too hectic and to make sure that all of the patients are getting their treatment?
So we give some certain helpline numbers or dialysis numbers or the technicians' numbers, that whenever they miss their dialysis, they come back to them and they talk to them, and then they get the schedules. Some amount of people will definitely call the doctors. So we are available almost like 24/7. There's a lot of disturbed sleep, but then it is in the interest of the patient. Like, we chose this job, so we have to carry on it.
Okay, doctor, to finally conclude this conversation, I think we'd really like to hear a message from you to other dialysis patients who might watch that, or students who are trying to help this process. So any final thoughts, any final messages?
This is a fantastic job what you have thought about and trying to motivate them and get back to their this thing. Down the line, 17 years down the line, this has come to me only recently when some of the patients I was talking to them, talking about the personal things. Then recently, like what I was telling, that one bank manager, he said he was very good in drafting and all that. But that is what it is very good inspirational thing that you have come up with this idea.
So much,
And it
doctor.
took us 17 years to understand, to go to their level and think about that. So that is, I'm absolutely fascinated with this idea.
Thank you so much.
Yeah.
Doctor, in our initiative, Project Vita, we're aiming to introduce a patient-turned-trainer model. What this model essentially is that dialysis patients that have received vocational training can give that vocational training to other dialysis patients. So it's a model that can help giving these patients employment and in turn empowering other patients as well. Do you think that this is a sustainable model and that it would work out and is scalable for dialysis patients as well?
So just to reiterate Aahana's point, we want patients who have gone through the mentoring process to become the next mentors for these other next set of patients. So this cycle keeps happening. Patients are teaching other patients. Do you think that's something that could work?
That is a fantastic idea. Really, it is very inspirational that you have come up with this project. And I actually feel bad that why we are not thought about this concept because even the nephrologists or the government aspect, they're not thinking about, they're only thinking about how many numbers we are doing, how much income we are generating, how much income the nephrologists are getting. We are not looking into their other social aspects. I'm very glad that you have come up with this project, and it will definitely help a lot of patients. And the more you interact with them, you feel that they have been deprived of so many things. And it is not that just they come for the dialysis. You have to go down to their level thinking and then try to motivate them. Definitely one dialysis patient will definitely inspire many other. This is a fantastic idea, and I'm very glad that you youngsters have come up with this project.
Thank you so much, doctor.
Thank you so much, Doctor, for being here with us today. And thank you to everyone that's watching. We'll be having more guests coming soon. We have dialysis patients and now doctors for different perspectives and insights.
Stay tuned for more episodes.